Morehouse School of Medicine is one of the 4 HBCU, historically Black colleges and university medical schools in the nation. It's the youngest of the 4. It was formed in 1975 on the campus of Morehouse College. But we were created to lead the creation and advancement of health equity, working with communities of color, and as well as training students. We're also a research institution. When COVID-19 hit, of course, we provide health care to the community. The patients were at risk, but also we did the studies to show that COVID-19 was impacting Georgia and disproportionately impacting the communities of color, especially the African-American community. We were already suffering in these communities with the high incidence of chronic diseases such as diabetes and hypertension. And then when COVID hit, that was a greater impact on communities who also have less access to care. And therefore, we had this opportunity to apply for this funding with OMH to develop the National COVID-19 Resiliency Network. We have a great working relationship and gotten to a place now we are developing something that's going to be impactful. But KPMG has been a good partner to work with, accommodating, really understood the model.
We have a mutual understanding of what the mission of Morehouse School of Medicine is. And I think by having that understanding, we were looked at as a partner who could come to the table and hit the ground running.
What's unique about our work with Morehouse is that we're applying advanced technologies and data and analytics to target both the populations and pair them with the services and the supports that they need. Traditional approaches to this type of thing have relied on funneling money into community-based organizations and others that have access and reach into the community. And while that's a key component of the Morehouse strategy, the technology and data and analytics is what sets it apart.
KPMG was very uniquely positioned based on our extensive research over 5 years developing the Signals Repository. What the Signals Repository is, it's a database made up of various data points that we're getting from CDC, public health agencies, academic centers, where we're bringing all of this rich information in together, where we can bring that to Morehouse School of Medicine.
I think it's really important that you think about Salesforce and KPMG. It's 2 world-class companies with world-class resources at our fingertips, and we were able to leverage all of those resources to build this solution. So when you think about the Morehouse data and you think about the project, what we were able to do through working with KPMG was analyze all that data and put it in a format in which people could make better informed decisions.
One of the main components is a user-facing portal that allows underserved communities to have access to a flexible, easy-to-use platform to get access to information, to being able to connect with resources around them locally, but also being able to connect with community-based organizations that can help them in these difficult times. The second component, of course, is a program management piece within the Salesforce platform that Morehouse School of Medicine and the community-based organizations can use to manage interactions. The third piece is a communication platform, and this is where we're able to drive targeted communication, responding to their questions, and really helping them connect to services that matter.
But also, as we think about going forward, we know that some of these populations may not have access to a local healthcare provider. We know that some of these populations don't have access to a CVS or a Walgreens. So we're looking at embedding telehealth capabilities into this platform. How do we do outreach to these populations that, again, are most negatively impacted? This platform can be used for diabetes, hypertension, some of those unique health disparities that impacts certain populations. But more importantly, we want this platform to be the platform that really moves the needle and levels the playing ground when it comes to healthcare and equality for all. So this is the first step, but it's a very promising first step.
Morehouse is not alone in trying to address this challenge of health disparities within COVID-19. We're working with clients across the healthcare continuum, including the federal government, state and local governments, healthcare provider clients, retail clients, on their own initiatives and strategies in trying to address this problem. They see the power in what Morehouse is trying to do. We're working with them to think through how they can either interface with the Morehouse strategy or adopt and adapt portions of it into their own initiatives. It's really exciting work, and we're proud to be a part of it.